So we finished treating her. We had the foam placed in a V pattern under each hemipelvis. And I'm now able to take up the slack as I was before, but when I thrust it, it bounces back. Let's have you lie on your stomach. And I'm now taking up the slack superiorly. Seems like there's more movement in that direction. And I bounce it, and you can see the head bounce, and you can see it recoil. So we've restored the recoil in these spring tests. And then here is a lateral spring capturing the PSIS right here, capturing the ilium. And I can take up the slack, and then I can spring it, and it bounces back. So we have restored the recoil, and the other thing that we've done is we've restored sacral mobility. So now I'm taking up the slack. Show the heels, please. So now I push through the sacrum, and the force translates through the SI into the hips and down to the lower extremities. And now I'm going to spring it, and you see the heels bob. So now there's sacral mobility. And here's inferior glide mobility of the sacrum. So I can take up the slack and I can spring it, and you can see the heels bob up and down. So hands on the sacrum again. I'm sorry, film on the sacrum. So I can take up the slack and I can spring it, and it moves and it recoils back. What's interesting is that the sacrotuberous ligament still feels indistinct. And it might be that through strengthening the hip rotators, including piriformis, which partially originates partially on that ligament, and strengthening gluteals, maybe we can increase the tone in that ligament. And it might be that wearing an SI belt for a period of time will be helpful, and I advocate wearing it low on the trochanters. There's a couple of research studies that show 40% greater compression when the belt is worn low. So I think we're off to a good start. I'm pleased that we were able to restore that property of recoil, and so I would submit that we repositioned the ilia in relationship to the sacrum and reduced hypermobility. Thank you.